pain somewhere in your body so bad you simply can't stand it. Pain so bad you can't drive, can't go to work. Pain so bad you just can't live a normal life. It would be terrible. Yet there are countless people here in this country who face living with those conditions every day they get up. They need help. And in order to get it, they come to a doctor like the one you are about to meet. He is board certified in both anesthesiology and pain management, and he is specializing in interventional pain management, one of the fastest growing medical specialties of the last 10 to 12 years. His name is Dr. Philip Rubenfeld here at New Jersey Pain Management in Denville. The doctor's goal? It's simple: help to eliminate pain in his patients.
They're now monitoring pain as a vital sign, as they never did before. And we are trying to precisely locate an area of origin of pain and then target our treatment to that area.
Is this an area of medicine that is really growing?
Yeah, pain management continues to grow as we find and discover new ways to treat painful conditions, new medications, new devices, new treatment modalities, and we have more things to offer patients now than we did 10 years ago.
Tell me a little bit about the stimulators that you use for the spinal cord.
Spinal cord stimulation involves placing an electrode into the epidural space behind the spinal cord. The patient feels the stimulation as a non-painful, tingling type of sensation. The patient will have this electrode in for 3 to 5 days and determine whether they feel it's effective in controlling their pain. And here is the wire that is connected to the electrode, which is placed behind the spinal cord. These electrodes can be programmed in many different ways to provide stimulation to different areas, but specifically to areas where there is pain.
I was looking to get my life back because I was just so consumed between taking medication and running from doctor to doctor and not wanting to go anywhere. And if I would have come here first, I probably would have had my problem solved years ago. This man is just an absolute genius, and he's very compassionate. He listens to you, he feels for you, and him and his staff are just so professional. I'm just so happy that I finally got to the right place.
I was in a lot of pain on my right side, and I spent 9 days in the hospital and then 6 months going from doctor to doctor, test to test. I tried nerve blocks, but they only lasted a short period of time, and I didn't want to stay on medication forever. So when I came to see Dr. Rubenfeld, he told me about this procedure, and I would recommend this to anyone that was in pain severely and needed some relief, because it's really given me my life back. I have 3 kids. I basically did nothing all day, and now I'm fully active again with my kids.
In some cases, we can cure the cause of pain. There are interventional techniques which will treat, for example, a herniated disc. But for the most part, in chronic pain conditions, we are trying to reduce the pain significantly. And when I say significantly, I mean by at least 50%, and in many cases, 100% reduction in pain.
What are some of the other methods you use to help relieve pain?
This is a model of the lumbar spine, but we do injections in the entire spine, depending upon where the patient's pain is, depending upon where I feel the pain may be coming from, determines where the injection is performed.
How long is that injection effective for?
What we're trying to achieve here is a reduction of inflammation. So basically the body has an opportunity to heal on its own. And the duration of effect can be anywhere from weeks to years.
You know, when you're in pain, pain is an invisible monster. And I have reflex sympathetic dystrophy, which is the worst nerve pain that you can have, and it never went away. I never rested, I never slept, so my surgeon recommended that I see a pain specialist, and he recommended me to Dr. Rubenfeld. And from the minute I met him, he understood my pain. He was very sympathetic about it, and like I said, from the minute I met him, he did everything he could to help me.
We also treat this condition with medications such as morphine, OxyContin, fentanyl. Because again, what it is a firing of nerve cells, sending a message of pain. They're firing out of control, and these very powerful opiates are geared towards blocking that message. or try to modify the message of pain that's going to the brain so that they can undergo physical therapy and get the extremity moving again.
My major role is to take care of the patients who are what we call medical management patients, who have usually failed the injections, epidural steroid injections, specifically for low back pain.
They really haven't been effective for them up to that
Right,
point.
and they have tried physical therapy, they've tried acupuncture, all sorts of things, and nothing's been helpful for them. And so what it comes down to is that they have to rely on medications daily to relieve their pain.
So in effect, you're charting their use of the medication so that they don't abuse it.
We do. We require most of our patients that are on chronic opioid therapy that they come in every 28 days. They get an allotment of pain medication for those 28 days. We occasionally do urine drug screens on them to make sure that they're taking the medication that we're giving them.
It is very rewarding to be able to help any patient who's been suffering with chronic pain for months, years, and when you can do something that significantly reduces that amount of pain and improves their function, they're forever grateful, and I can't imagine doing anything that can have more of an impact on somebody's life.
A look at how the latest in medical science and technology are helping doctors like Dr. Rubenfeld here at New Jersey Pain Management to eliminate pain in his patients. I'm Doug Llewellyn reporting from Denville, New Jersey.
Well, that does it for this edition of Close Up on America's Business. I'm Janice Marie. Thanks for joining us. We'll see you next time.